Hi, my name is Dalton. I'm an occupational therapy student. I'm going to be working with you today. Can I please get your name and date of birth?
Damon Evans, September 3rd, 1979.
Okay, perfect, Damon. Okay, so first we're going to be starting with getting some of those vitals, okay? Okay. So now I'm going to be taking your blood pressure. So I'm just going to come on over and put the cuff on you and do that. I can have you put that left arm on the table. Please make sure that you are keeping your feet flat on the ground. Do not cross your legs. Just relax, okay? So we have a touchy. Perfect. Okay. I'm just gonna hook this up. It's just gonna be like a nice little hug on your arm. Let me know if it's too tight. Okay. Let me get that a little tighter on you. Okay, feel okay? Okay, perfect. Okay, so now I am going to take that blood pressure, okay? Okay. Okay. Okay, so it looks like that blood pressure is 122 over 78, so it looks like it's within a healthy range. That systolic is a little high, not by much, but if you start feeling dizzy or lightheaded or anything, just let me know, okay? While we're doing exercises, perfect. I'm just gonna wipe this off really quick and clean it, and then I am going to be taking your pulse rate. So I just want to make sure it's all nice and clean. Okay, and I will set this over here. Okay, so if I can have you put that left hand like that, like so. Okay, perfect. And then I'm going to be taking that pulse rate, okay? Okay. Looks like you were at 82 beats per minute and 16 breaths per minute. So with those beats per minute, with that pulse rate, the average is typically about 60 to 100. So you're about right in that middle of that average, which is good. And then for your breaths, it's usually about 12 to 20. So again, we're about right in that middle. So we're doing good. So next, what I am going to have you do is I'm going to have you place that left hand just gently on the table. Good. And then I'm going to clean this off for you real quick. And I'm going to measure your blood oxygen level. So, okay. Then if I can have you put the index finger up, or index, right? Is index? Yeah. Thank you. This is the easy part. Perfect. So we are at 97% on oxygen, and I'm gonna take this off, and I'm gonna clean it off really quick. Okay, so it looks like those vitals are good. It looks like there's no issues. If you start feeling dizzy, lightheaded, anything like that, just let me know whenever we're doing those exercises later, okay?
Okay.
All right, perfect. So now we're going to go into just a little bit of conversation, just kind of some things that are important to you, what you're trying to get out of therapy, things like that, just so I know kind of what assessments to perform, okay? Okay, perfect. Start with the games. Okay. And then what are some things that you kind of like to do for fun around the
Um,
house? Like what's a typical day look like?
I like to play games with my kids.
Okay.
So we play Battleship and we play with Legos.
Okay.
I cook for my kids.
Mm-hmm.
Take care of the animals,
Mm-hmm.
and then I like to watch movies.
Okay. And do you have any difficulties, any issues with playing with your kids or with the movies, anything like that?
Yeah, playing with my kids, I have a hard time moving the little pieces.
Okay. So just those little pieces, just being able to move those around, just kind of hard to pinch them.
Yeah,
Do you normally try to use that better, that right side, just because it's a little bit easier?
yeah.
Okay. And then just kind of let the left side, not really try to use it too much whenever you're playing.
Hmm.
Okay. Okay. I got you. So what with MS, with multiple sclerosis, do you have any issues kind of with fatigue? Is there anything that exacerbates it? Anything like that? Is it kind of just kind of explain that to me?
Yeah, heat really makes it worse, and
Okay.
it makes me really tired. So
Okay.
when I'm taking showers,
Hmm.
with the hot steam and stuff
Yeah.
makes it hard.
Okay.
Steam in the kitchen when I'm
Of
cooking
course.
also makes it hard,
Hmm.
and then in the garage, if I fall, then the cold will affect it too.
Okay. So it's not just heat; it's just kind of a rapid
Yeah.
difference in temperature will kind of start to make it harder. Okay. And when with your fatigue, is it pretty similar every day? Is it kind of day to day?
It's day to day.
Okay, so some days you'll feel a little bit better, some days not.
Mhm.
Okay. Do you normally have kind of a routine that you do? Do you normally try to get a lot of things done, early in the day? Just try to. Okay, so you do some things, try to conserve that energy, things like
Yeah.
that. Okay. And then what are some of the things that you think would be most important to you that you would want to get out of therapy?
I want to be able to do everything as independently as possible
Okay.
because I don't want to have help.
Yeah. Of course.
And then I want to be able to spend more time with my kids and
Of
play
course.
games with them.
Of course. Okay. Okay. Well, all right. So it sounds like we kind of have some issues with balance. It sounds like we have a little bit of issues with kind of that fine motor, just being able to pick up those real small pieces, things like that. And then just that kind of that gross motor with that grasp, which that would just be, grasping a knife, cutting, things like that with that left hand. And then some of the things we have to worry about whenever we're doing is just that energy conservation. It sounds like you have a good little grasp of that already, which is good. Um, and then obviously that kind of that balance, and then the falls obviously, which is being a little too weak, trying to get up out of the chair, things like that, and then worrying about those rapid temperature differences with that hot shower or with kind of being on that cold, anything like that. Okay, so we're going to do a couple assessments just to see some baselines, get some information, just to see where you're at on a few things, just to see exactly what we want to work on and how we want to work on it. So we're going to do that next. Okay. Okay. Perfect. Okay, so now we are going to be doing the Berg balance scale. It's just going to be a scale to test your balance, as in the name. And so, in a study by Avat et al., it talks about how the Berg balance scale is a sensitive and specific measure used for predicting falls in patients with MS. And I know how you've said you went from falling about once a week to about once every 6 weeks, but we'd still like to kind of work on that balance, still kind of keep improving it because we don't want to be falling especially that much. Okay.
Okay.
Okay. So I am first going to give you a quick hug and put this belt on. And then this is a standardized assessment, so I will be reading off a script. So it's going to be specific instructions. So if I can have you raise those arms for me, get around. Thank you. Perfect. Place it right there. Good. It's just going to be like a nice little hug. I put it backwards. So that gate belt is just going to be for a little bit of safety. So now I'm going to administer the test. So if you could please stand up, try to not use your hands. Okay. Good. And then please stand for 2 minutes. Please sit down. And then can I have you scooch forward a little bit with your back unsupported? And then please sit with your arms crossed for 2 minutes. Okay, so now I'm going to have you move from this chair into that chair, and then I'll have you move back from that chair to this chair, okay?
Okay.
Just any way you like. Okay, and then back to that chair. Okay. Please close your eyes and stand still for 10 seconds. Okay, gotcha. And then if I can have you place your feet together and stand without holding on. Do you need a little help?
Yeah.
Okay, I'm gonna help you get there. Okay, okay. And then I'm gonna start the timer, okay? Okay, I gotcha. Here, put your arm out straight ahead of you at 90 degrees, and then I'm gonna have you reach forward as far as you can, okay? Okay. And then I'm gonna have you sit down. Good. And I'm gonna mark it real quick. And then just to show. Pick up the shoe, which is placed in front of your feet. Oh, I gotcha. I gotcha. Okay. Over your left shoulder. And then repeat to the right. Okay. Turn in a complete circle. Okay. And then pause. Good. And then go turn the other way, other direction. Place each foot alternately on the stool and back down. Continue until each foot has touched the stool 4 times. I gotcha. Okay. Place one foot in front of the other. If you feel that you are not able to do that, place one foot to the side in front enough that the heel is in front of the toes of the other. Stand on one leg as long as you are able to without holding on. Okay. Okay. Maybe take a seat. Okay, reach back. Good. So I looked over your Berg balance scale and I tallied up your score just to see what it was. So just to kind of tell you what the Berg balance scale is, it is out of a potential 56 points. Each one is going to be anywhere from 0 to 4 points depending on how you did. And you got a total of 20 points out of 56. So there are three kind of ranges that you can fall in this, and you scored in the very top of the bottom score. So that would mean that you do have some pretty significant balance issues, which we were aware of, yes. And so that's just going to be something that we're definitely going to be keeping in mind, something we're going to be looking at. Some of the things that you scored the worst on, obviously, was standing unsupported with your eyes closed. I know we talked about earlier how you have a lot of trouble with that. You scored pretty poorly on being able to turn 360 degrees. That could just have something to do with not really being able to use your eyes while you're turning, having to kind of have that sensation of being able to move around without being able to see it. Placing one foot on a stool, so that stepping up we're having a lot of difficulty with. Standing unsupported with one foot in front of the other, so just not really having that support and being able to keep that balance. So definitely things that we can work on, definitely things that we can improve. So I'm going to give you a home exercise plan, and we're going to work on that together. I'm going to show you how to do it. I'm going to have you show me the exercises back, and then I will give you the frequency, everything like that I want you to do in between therapy sessions. And we are going to start to try to improve some of those balance issues, okay? Okay, perfect. Okay. And then do you have any questions for me?
No.
No? Okay, perfect. Okay, so we are going to be doing the 9-hole peg test. It's just going to be testing that manual dexterity. I know you said you have some trouble kind of with the small pieces whenever you're playing with your kids, things like that. And so, in a study by Sefarolu et al., it talks about how the 9-hole peg test has really good and high retest reliability in individuals with multiple sclerosis. So, I'm going to be using it for that just so we can kind of have a baseline to see where you're at so we can kind of track that improvement. So it is a standardized test. So I'm going to be reading off the script to you. I want you to follow my instructions exactly, and I will be administering the test. And then I'm going to keep it on this towel. That's just so it doesn't slip, slide anywhere like that. Okay. Okay. So I want you to pick up the pegs one at a time using your right hand only, and put them in the pegs in any order until the holes are all filled. Then remove the pegs one at a time and return them to the container. Stabilize the pegboard with your left hand. This is a practice test. See how fast you can put all the pegs in and take them out again. Okay. Are you ready? Go. So this will be the actual test. The instructions are the same. Work as quickly as you can. Are you ready? Go. Faster. Out again. Faster. Perfect. Okay. So now I will flip it. Okay. And then I will be giving the instructions. So now we will be doing the left hand. So I'm going to read the instructions. Pick up the pegs one at a time using your left hand only, and put them in the holes in any order until all the holes are filled. Then remove the pegs one at a time and return them to the container. Stabilize the pegboard with your right hand. This is a practice test. See how fast you can put all the pegs in and take them out again. Are you ready? Go. this will be the actual test. The instructions are the same. Work as quickly as you can. Are you ready?
Mhm.
Go. Faster. Faster. And out again. Faster. Okay. Alrighty. Good. I did the math on your scores just to determine the z-score. So what that is it is essentially your score compared on something called standard deviation, comparing it to the average score of people that have taken this test. So I've compared your right, which is your dominant hand, and you got a 0.03, which means that you are right about at average for people that are taking this test, which is good. It means that we could still stand to see some improvement, but it is right about average, which is what we want to see. And then with your left hand, you're at 2.7 standard deviations away, which means that that z-score is quite low. It means that left hand did have some difficulty, and it would be quite a bit lower than the average of people that have taken this test with their non-dominant hand. So we do need to start working on that left hand, trying to get some of that fine motor coordination, okay? Do you have any questions for me? Anything like that? You understood how it works compared to that average and everything?
Yep.
Perfect.
Okay.
Awesome. Okay, so we are going to be doing a grip strength dynamometer test. We're going to be using a tool called a dynamometer to test your grip strength. So it's an apt name. In a study from Cefarolu et al., it talks about how grip strength is directly correlated with quality of life in MS patients. And so I know earlier you mentioned how you have trouble with that, being able to grip things whenever you're cooking for your wife, your kids, things like that. And that's one of your main duties in the house. So I just wanted to look at that grip strength and just see if there's any weakness that we need to address. Okay, so we are going to be using this right here. So it is the dynamometer. And so what I'm going to have you do is I am going to have you place your arm at 90 degrees and you're right-handed dominant, correct?
Yes.
Okay, good. So I'm going to have you use your right hand first, and I'm going to have you place your hand at 90 degrees with the dynamometer up. I'm going to hand it to you, and I'm just going to have you squeeze for about a second as hard as you can, and then release, and then hand it back to me. I will look at what you got, and then I will wait 30 seconds and hand it to you again. And we're going to be doing that 3 times on each side, and then once we're done doing 3 times on the right side, we will go to the left, okay? Okay. So I'm going to hand the grip dynamometer to you. And then another thing is just make sure that those feet are flat on the ground and you're not trying to curl those toes or anything like that, okay? We just want to get the strength from that grip, nothing else. Okay. So whenever you're ready, I'll have you squeeze, and then hand it to me. Good. And then I will set the timer. Okay. And then that's what I got. Good. And then at 10 seconds left, I will let you know that there are 10 seconds left. And then at 5, I will hand you the grip dynamometer back, okay? So there are 10 seconds left. And we're doing it 2 more times. And then I'll hand you this, and I'll let you know when to squeeze, okay?
Okay.
And squeeze. Good. Then hand it back. Good. Then I will start that timer. And one more time. Then this is the number. And I will reset it again. Ten seconds. Excuse me. And then 5 seconds. Good. And then squeeze. Really good. Perfect. And then I will show the camera. Okay, and now we're going to be doing that left side. Okay, so now we're going to be doing that exact same thing. I'm going to have you put that hand or that arm at 90 degrees, have that elbow there, and then I'm going to have you squeeze. Feet are firm on the ground, feet are flat on the ground, not curling those toes. And then after you get done squeezing, you're going to hand it back to me. I'm going to look at the score, and then I am going to give you 30 seconds, and we're going to do it again. And we're going to do that 3 times, okay? So I'm going to have you take it. Your feet flat on the ground, elbow 90, perfect. And then squeeze, squeeze, squeeze. Good. And then look, and then I will start that 30 seconds. And then right there. And then I will reset the number. And then at 10 seconds, I will let you know, which is right now. There's 10 seconds left, and at 5 seconds, I will hand it back to you, okay?
Okay.
So I'll hand it back to you. Good. And then squeeze. Squeeze. Good. And I will show the camera. Okay, and I will write it down. Right there. And so wait. So you've got 10 seconds. And then 5 more seconds. I'll hand that back. And this will be the last one.
Okay.
And then squeeze, 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 squeeze. Good. And back. Perfect. Okay. Okay, perfect. I'm going to reset it. Okay, so now what I'm going to do is I'm going to take the average of the 3 on each, and then I am going to put it into a formula to find something called a z-score. Essentially what that is, I'm going to use that score to compare to something called the standard deviation, or compared to the mean, which is going to be the average of other people's scores that have done this test. And it's just to see if you rank higher or lower for people that are within your age and are the same gender. Okay. Okay. So I did the math on it to find your z-score. And so we'll start with your right hand. We'll start with that dominant hand. So you are negative 0.7 standard deviations away from the mean, which means that you are a little bit below the average, not too much, but you are below average in terms of that grip strength. So there is some work that we need to do on that right side as well, that dominant side. And then with the left side, it is negative 2.4 standard deviations away, which means that it's quite a bit below the mean for people's non-dominant hands or your left hand. So that means we do have quite a bit of work that we need to do on kind of that grip strength, just to kind of make some improvements on it. Okay. Okay. Perfect. Do you have any questions about that or anything?
Nope.
We're good. Okay. Perfect. Okay, Damon. So, do you have any questions, concerns after the assessments? Okay, perfect. Okay, so next we are going to be going into the home exercise plan. So, I'm going to be having you do it about twice a week at home. I'm going to be giving you some handouts with it, as well as I'll be demonstrating them to you today, as well as you demonstrating them back to me, just to make sure that you understand them. But before we get into that, I'm just going to educate you on a little bit of just activity tolerance, things like that. So what we are going to be using is going to be called METS. It is going to be the metabolic equivalent of task. It's just a big word, big fancy words for energy expenditure, how much energy you expend in a particular activity. So I know we talked about earlier, we talked about showering, we talked about cooking. So typically cooking, showering, things like that are going to be about a 2.0. So it's on quite a high scale. So at rest, you're using about 1.0 METs. So that's going to be your baseline energy expenditure. Okay. So anything from about a 3.0 down is going to be light activity. That doesn't necessarily mean that it's easy, but it does mean that it's classified as light activity. And so with like cooking, showering, that's going to be about a 2.0 to a 2.5. So I know you said that those are kind of difficult for you, but you are able to complete them. And so we would classify that about near your max would be about that 2.5 to maybe getting into a 3.0, but that might be a little too strenuous to where you might not be able to complete the activity. So all of the activities that we have in this home exercise plan are going to be anywhere from about a 1.2 to about a 2.0. So some of them might be a little more strenuous than others, but none of them should be so difficult that you're unable to do them. And then just with that energy expenditure and things like that, things that we're going to have to look out for is going to be obviously that fall risk. All of these are going to be sitting. And so you should not have to worry about that while you're at home. If you feel more comfortable, you're more than welcome to have your wife there with you and just assisting you, not necessarily with the exercises, but just if you do feel like a little uncomfortable while you're performing them. But that's also why I'm going to be demonstrating them with you, just so you feel confident in them. And then a couple other things. In a study by Halabji et al., they talked about things like managing the heat intolerance and things like that. So obviously with that steam from the shower, with steam from the cooking, that could also play a factor. So anytime we're doing this at any point, if you do start to feel like you're getting a little flushed or getting a little too warm, please let me know and we can take a break or we can stop if needed. And then if you do have that happen at home, again, make sure that you stop, give yourself a little bit of a break. If it does persist, I would recommend going to your doctor just to make sure that everything is okay. I do understand that with MS, it can kind of be day to day, like you said earlier, with that fatigue. And so sometimes this might be a little more strenuous than others. So just make sure that anytime you're doing these activities, you're being mindful of that. You're being mindful of that energy expenditure, things like that. You are more than welcome while you're doing these to do them in any order you would like. You're welcome to do them not all at once. You can take breaks at any point. You can do them throughout the day, anything like that. Just like I said, I would like you to do them twice a week. Okay. So we are going to be getting into these. Do you have any questions on METs, anything like that? It seems pretty good.
No question.
Okay, perfect. Okay, so we are going to be getting into the activities, and we will start with the first one. Okay, so the first exercise that we're going to be doing is going to be a chair push-up. So I'm just going to give you this, and I'm going to be explaining it to you and demonstrating it to you while you're doing that. Once I get done demonstrating it, what I'm going to do is I'm actually going to put a gait belt on you just for safety, and then I am going to be taking your pulse and your heart rate. In a study by Halapchi et al., they do talk about how that is one of the indicator precautions that you need to look out for people with MS is just making sure that their heart rate doesn't get too elevated. Again, that kind of goes with that heat sensitivity, just to make sure that your blood pressure, you don't get too your heart rate doesn't get too elevated, you don't get too hot. Just making sure that we're staying safe. Okay. And then, so what we are going to do is while you're reading that, so I'm going to be having you do this for 2 sets of 10. So 2 sets and then of 10 repetitions each. So you're going to do it 10 times twice. And what you are going to do is you're going to, with your feet planted firmly on the ground, you're going to place both hands firmly on the armrest, and you're simply just going to push yourself up and hold yourself. You're just going to get just enough to where that butt comes up in the air. Not so much that you're leaning forward, not so much that you're kind of going way back, just enough that the butt comes off. Hold it for 3 seconds. So 1, 2, 3, and then gently put yourself down. What I don't want to see is I don't want you to plop back down. I don't want you to try to shoot yourself up too high. I want you to be nice and controlled throughout the whole movement. Hold it for 3, and then come back down. Okay? Okay. So, and then do you understand everything on there? Do you have any questions about the home exercise plan? Okay. Then I will take it from you, and I will give this back to you whenever we are done. So I am going to, here, I'll set that right there. So I'm going to put the gait belt on you. If I could have you raise your arms. I'm just going to give you a hug. Thank you. And then you let me know if it's too snug, okay? I want it to be snug, but not so much that you can't breathe. It's a nice fashion piece. And right there. And then if I could have you stick out that finger, turn this on. Thank you. And right now I'm just getting a baseline of that heart rate, okay? So it looks like that heart rate is at about a 90, 83, 77. So it's actually going down. So you're at about a 75, okay? Perfect. And so I'm going to have you demonstrate the exercise. I want you to do it 5 times for me, okay? 1, 2, 3. And then make sure you count out loud right now, okay?
Okay. 1, 2, 3.
Thank you. I just want to make sure you got it. Perfect. 3 more.
1, 2, 3.
Good.
1, 2, 3. 1, 2, 3.
Perfect. And the reason why we're doing this, we're going to be doing this because we're working on, I know you said earlier, a lot of your falls are usually coming from you kind of trying to shoot up too quickly or you not having that strength to put yourself up. So with this, we're just practicing. We're just getting those arms stronger to be able to lift ourselves up to get up safer, okay? Okay, perfect. Do you have any questions, anything with the pamphlet, anything with anything else? Okay, I'm going to take your more time just to make sure that everything's okay. Okay. So it looks like it is at at about 77. So it is a little higher than it was, but not too much. It's going, it looks like it's already starting to go back down, which is good. That's what we want to see. So are you feeling okay? You're not feeling tired, flushed? Perfect. Okay. So now we are going to be moving on to the next exercise. So the next exercise that we're going to be doing is going to be leg lifts. So there is your home exercise. So for this, I'm going to have you do 2 sets of 10 repetitions as well. And again, anytime you're doing these, if you feel like you're ever having too much trouble or you're flushed, you're welcome to take breaks. You can break them up as much as you want. I do ask that just if you do start the exercise, you do, if able, obviously, try to finish the set you're on. But if you're unable to complete the full activity, that is okay. Obviously, I know with MS, sometimes that fatigue can be a little challenging. But with the exercises, try to complete them as best you can. And then if you want to stop and come back and do another exercise later, that's perfectly fine. It's just I'd like you to make sure that you're doing them twice a week. So with this one, what I'm going to have you do is I'm going to have you sit in the chair, just nice comfortable with your feet flat on the ground, and then you're simply just going to raise your leg up as high as you comfortably can, hold it for about a second or two, and then put it back down, and then you're going to lift it back up. And so when I say 2 sets of 10, you're going to be doing 2 sets of 10 on each leg, okay? So technically it would be 4 sets of 10, but it's going to be 2 on each leg, okay? Do you have any questions? You understand? That sounds good, clear, perfect. Okay, and then again, I'm going to check your heart rate after. Do you have any questions on the home exercise, anything like that? Okay, and so if you could just demonstrate to me what I showed you. Good, and just do 5, and just if you can count them out for me. You can alternate if you'd like. Alternator at the same time, it's okay, it's just fine. Try to hold them for a little longer. Good, perfect. That feels okay? Perfect. And so we're doing this because I know that you said you're having a little bit of trouble with that step up in your home, which could lead to anytime you're out with family. Perfect. Anytime you're out with family, anything like that, I'll check that as well. Could make it difficult with those step ups, like with curves and things like that. So this is just try to help kind of get that clearance a little bit, especially at home with that level. And so give it a second to read it. This is just so we're able to get over that clearance. That way our foot's not catching, we're not falling. We're trying to reduce those fall risks. So it looks like it is at a 79. So starting to go back down a little bit. So we're feeling okay. We're not too flush. Perfect. Alrighty. So now we are going to go on into the next exercise. So the next exercise that we're going to be doing is going to be called chair snowboarding. It's going to be something a little different. So I'm going to have you look that over. So I'm going to be having you do this one for 3 sets of 10. So it's going to be 3 sets of 10 repetitions each. And what it's going to be is I know how we talked about how you used to be a snowboarding and skiing instructor. So this is kind of a little bit of an homage to that. Just kind of, I know that you said you want to get back to that one day. So this is something similar. So what I'm going to do is I'm just going to demonstrate it for you in the chair. So what I'll have you do is I'll have you scooch just a little forward to where those legs have a little bit more room out. You're going to still have those glutes nice and firm on the chair. We're not going to be, leaning too far off where we're barely on, but we don't want to be so far back that we're leaning up. We want to have our back unsupported, not against the back, okay? And what I'm going to have you do is I'm going to have you not supporting yourself with your arms, not supporting with your back, and you're simply just going to go forward and lift up those heels off the ground. Make sure we're keeping that core nice and braced, and then push ourselves back up, and then we're going to lean back, and we're going to lift up those toes to the air, kind of like we're trying to balance ourselves like we're going down a mountain on a snowboard, okay? And it's just to kind of try to activate that core. We're just trying to work on that balance a little bit because this is going to kind of take our center of gravity and change it up a little bit, but we're doing it safely in the chair, okay? Perfect. So do you have any questions on the activity? Do you have any questions on the home exercise? Okay, perfect. So I've already taken your measurement, so we know that your normal resting heart rate is going to be about 75, 76, somewhere in there. So I'll take it again at the end, just after this exercise, just to make sure you're okay. And so I'll have you demonstrate the activity. And then lift those heels up. Good. And we'll have you do it 5 times, okay? And then lean back, get those toes in the air. Does it feel okay? Mm-hmm. Good. Good. Perfect. And then if you do want, whenever you're doing it, if it does feel like it's a little too easy, let me check this while I'm explaining. Thank you. If it ever does get too easy, something you can try is keeping your arms out, kind of just shifting it up even more to where we're not so far close in and stable, more so where we're out. That's just going to make it a little more challenging. That might um, make it a little bit harder on you. That's just kind of to help improve it. So if you want to try that, you can whenever you're home. You don't have to now, obviously, because this is the exercise. So it looks like it is at about 84. So it is a little elevated. Are you okay? You feel all right? Not flushed? Okay, good. And then do you have any questions on this? Okay, I'm going to leave it with the other one that I gave you, and we are going to go on to the next exercise. Okay, so the next thing that we are going to be doing, I'm going to have you hold that. That's just going to be exercise plan. So what I'm going to have you do is it is going to be, I'm going to set this right over here really quickly. It is going to be donning or putting on a shirt. So I know that you do have a little trouble with that left hand, so it's just use that right hand to help, and then get that right hand in. So the reason that we're going to be doing this is not necessarily for putting the shirt on. That's just kind of an added benefit. Really, I want you to work on buttoning. Okay. So what this is going to be doing, it's not necessarily going to be dressing, because I know that wasn't really an issue that you were worried about. I know that you said you do have a little bit of trouble dressing with that left hand, just because you have a little bit of difficulty with it. But it is mainly going to be for that fine motor, because I know you've said that you have a little bit of trouble with that fine motor working in, the kitchen with grasping and things like that. So holding up the button as well as playing with your kids. Okay. So it's just going to be buttons, same before. And then what you're going to be doing is I want to have you do the full shirt. So it's going to be 6 buttons. So I'm going to have you do all 6, button and unbutton twice. Okay. And then do you have any questions on that? And okay, perfect. And then again, with something like this, if you do have to take breaks, take as many breaks as you need. I know it can be a little bit difficult. And then you said you did not have any questions, correct? Perfect. Okay. So I'm going to have you show me, and then take as many breaks as you need. If your hands start to cramp, anything like that, if you start to feel like you're flushed because you are going to be putting on more clothing, that could potentially make you a little bit warmer, could increase that body temperature. So that could be a precaution that we just have to worry about. So if you start to feel that, just let me know, and then we can take the jacket. Okay. So let's see. So I'll just have you button them up and down. I'll have you button 3 buttons and then unbutton them. Okay, just to show me. We're going to be working on that thinking too, because you're going to have to try to get the buttons to match up correctly. Good. And that feels okay? Mm-hmm. Good. Okay. Now unbutton. Good. Now I want you to try to use that left hand if you can. Good. Good. It feels okay? Mm-hmm. Good. Good. Perfect. Okay. And then I'm going to check that. Did it feel okay? Mm-hmm. Good. I'm going to check this, just to make sure we're still staying around the same heart rate. Good. So we're at about 77, 75. So good. We're right where we need to be. Okay. So we're feeling okay, not flushing, anything like that? Perfect. Alrighty. So now we are going to move on to. So the next exercise that we're going to be doing is going to be zipper pulls. So what I'm going to have you do is I'm going to have you put the jacket on. And so, like earlier with the shirt, I know you have a little bit of trouble with that left arm. So I just want you to put it on as best as you can. We're not worrying too much about the dressing, because I know you said that you don't have too much difficulty with that. It's just kind of an added bonus that we get. And then what I'm going to have you do is place the zipper on, and then you're going to use whatever hand is not holding the zipper is going to kind of stabilize it and keep it in one place. That way it's not too hard and you're going to be able to actually zip it. And then you're simply just going to zip the jacket up, and then zip the jacket down. And I'm going to have you do that 10 times on each, 10 times up. So going up and then going down is going to be 1. You're going to do that 10 times on each hand. And then once you get done with one hand, then you're going to flip and do the other. Okay? Okay. And do you have any questions on that? Like that? Good. Okay. So I'm going to hand you the jacket, and I'll take that. Good. Got it?
Mm-hmm.
Good. And I'll just have you right now, I'll just have you do it once up and down on each arm, okay? Each hand. Okay. And my left hand. Okay. Good. Good. Now I'm going to check that heart rate one last time. Okay, so we're sitting at about 79, so we're doing okay. So not feeling too flushed. Good. Okay, so we've got one more exercise that we're going to do, and that'll be all of the home exercise plan. And just to reiterate, all of these handouts I'll give you at the end. I just want you to have them now, just so you can kind of look over them. Okay, perfect. Okay, so this will be the last exercise that we do on the home exercise plan. Do you have any questions, concerns up to this point?
No.
Okay, perfect. So I know that you said earlier that you really like to play Battleship, Legos, things like that with your kids. So I thought, what better way to work on fine motor than to and pinch strength and things like that than to play Battleship. So we actually had one in the clinic, so I figured this would be a perfect thing to do. So I have a handout for you. Obviously, you know the rules of Battleship. But what I want you to be doing, and I will demonstrate it for you, is I want you to be using your thumb and index finger. I want you to be picking up the pieces, and then I want you to be placing them in. And then you can use the non-dominant, obviously, to stabilize if you need. And then I want you to take the other hand and grab the other piece if you need, and then put it in. And I want you to be alternating hands when you play, okay? And so for the frequency on this each week, I would like you to try to play it, whether it's with your kids or not. I would like you to try to use this at least for 10 minutes twice a week. And so that would mean even if you're not playing with your kids, you could bring it out. You could try to fill the board with the pieces. You could try to make patterns. You could see if your wife wants to play. That might be a fun little date night for y'all too, without the kids. And so what we're going to be doing just for this is I'm going to have you, and I as well, we will be placing our 2-piece ship. We're going to be placing it within the 1 through 4 section and the A through D. So we're only going to be using this 4x4 section, and we're just going to play a quick little game of Battleship. Okay. So do you need me to explain the rules, anything like that? You understand? So anytime you have a ship hit, you just put the red on it. If you don't, you put the white whenever one of us misses. Okay. Perfect. Okay. So I will have you take that ship, and remember, you are going to be alternating hands. Okay. And seeing as how you are challenged by me, I will let you go first.
C2.
Miss. B2.
Miss.
Okay. Good. Good. And so on the next one, you'll use your right hand.
A3.
Miss. A3. Okay. Good.
D2.
Miss. B4.
Miss.
Okay. It's getting exciting.
C1.
Miss. One of us is bound to get it at some point. Good. And that's feeling okay. That's not bothering the hands too much.
Nope.
Good. Let's go A1.
Miss.
Dang. Oh, you got nervous though, so it can't be an A though. Goodness.
B1.
Miss. C1.
Miss.
Oh my goodness. This is starting to become statistically improbable.
C3.
Hit. B3. All right, you got a 50-50 on if you can get it.
E3.
Miss. C3.
Hit.
Nice. All right, I got it. Okay, so do you have any? So I'm going to give you the packet. Do you have any questions or anything like that in home exercise? Okay, you understand all the frequencies, all the sets and reps, the MET levels, and like I said, and I'm not going to be checking your heart rate after this one. Obviously, while it is an exciting game, I do think this is going to be one of the this will be the lowest MET level exercise that we do, seeing as how sitting and at rest is 1.0. We're essentially sitting at rest and just working on that fine motor. So I'm not going to worry too much about it right now. Are you feeling flushed, anything like that?
No.
Okay, perfect. All righty. Well, then I will hand you that, and you have a wonderful day.
Thank you.